Okay, I believe all permissions for recording have been granted. If you did request permissions in the chat, you should now be able to record. And if you still need permissions granted, please just leave us another message in the chat. Dr. Vanderhoff, we'll hand it over to you now to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, as people often say this time of year, 'tis the season. And in the healthcare world, that also means we're entering the peak of respiratory season. Should be no surprise then that in Ohio and nationally, we are seeing an increase in cases of COVID, influenza, RSV, and other illnesses. I'll discuss each one of those individually in a moment. But I thought it was worth saying here from the start that of course, any increase in illness is something that we take very seriously and monitor very closely. We are grateful that our hospitals are not seeing the admission rates and the numbers of severe cases that challenged our healthcare delivery system in recent years. Nevertheless, case numbers are rising. And we know that as they do, we will see more hospitalizations and severe illness. Many Ohioans have taken the opportunity to get vaccinated, but many more haven't. The good news is that while cases are on the rise, there is still time to get vaccinated. And I'd encourage anyone still on the fence to get out today and get a shot. Now, let me turn to what the numbers are telling us. Certainly, our COVID-19 case numbers are on the rise recently. To this point, though, this season's increase is a bit less than what we saw last year, a year you may recall that was a huge improvement from prior years. The month of November of this year saw Ohio report 50,233 cases. That compares to 54,311 in November of 2022 and over 170,000 in 2021. COVID hospitalizations are currently averaging about 450 a week, compared to about 600 at this point last year, and between 2,000 and 3,000 in 2021. What I do find concerning, though, is the low number of Ohioans who have received the updated COVID vaccine that became available in September. To date, about 1.1 million Ohioans have received it. That's about 9.3% of us. We're encouraged that a higher number of older Ohioans, who of course are among those most at risk of getting seriously ill, have been vaccinated. 29% of Ohioans aged 65 and older. But clearly, there remains a lot of room for improvement. And let's not forget that this virus is still causing several dozen deaths every week in Ohio. Getting this vaccine, which replaces all previous COVID vaccines and boosters, remains your best bet for protection against severe illness. And recently, new research was published that shows a clear link between getting a third COVID vaccine and a lowered risk for developing the syndrome known as long COVID. Long COVID can include a wide range of ongoing health problems that can last weeks, months, or years. Long COVID occurs more often in people who have suffered a severe COVID-19 illness, but anyone who has had COVID-19 can develop it. We still have much to learn about long COVID, and unfortunately, there is no test that determines if symptoms you might have after infection are definitely due to COVID-19. People with long COVID, in fact, report a wide variety of health problems that may emerge, persist, resolve, and then reemerge over different lengths of time. Though most patients' symptoms do slowly improve with time, speaking with your healthcare provider about symptoms you're experiencing after having COVID-19 could help determine if you might have long COVID. In a recent survey conducted by the Kaiser Family Foundation, 28% of people who had contracted COVID reported developing some symptoms of long COVID. The researchers found that getting a third vaccine reduced long COVID risk in adults by 69%, Compare that to the risk reduction for those who have had only 2 shots, which is 37%. And it's clear that a third shot provides an important boost in protection against these long-term symptoms. In addition, research shows that vaccines help prevent multi-system inflammatory syndrome in children, which sadly can cause very severe complications in affected children. Vaccines help all of us. If you have not gotten the updated vaccine, I encourage you to do so. Turning now to influenza and RSV, we're also seeing a rise in these illnesses, though thankfully at a different trajectory compared to last year when RSV in particular hit us very early and very hard and severely strained many of our healthcare providers. Thankfully, while flu is also on the rise, our influenza numbers remain lower than our 5-year average for this time of the year. As with COVID-19, vaccines are important protection. For the flu, we encourage everyone to get a vaccine. For RSV, there are 2 different shots available, a vaccine for expectant mothers and a preventative antibody shot for infants. The maternal vaccine, called Abrysvo, in August received FDA approval and was recommended by the Advisory Committee on Immunization Practices. The recommendation is that pregnant women who are between 32 and 36 weeks between September 1st and January 31st receive Abrysvo. The shot for infants is called nirsevimab. The CDC recommends infants born shortly before or during the RSV season who are up to 8 months of age should get this shot. Importantly, though, it is usually not necessary for mother and child to both get shots. If the mother received a vaccine during pregnancy, her baby should be protected and would not need nirsevimab. COVID, flu, and RSV are the big 3 viruses you've heard me talk about so often. This year, we have seen an increase in a variety of other respiratory illnesses, including well-known bacterial pathogens we haven't seen much of the last few years. One of those is the bacterium Mycoplasma pneumoniae. Historically, one of the more common causes of bacterial pneumonia, especially in younger people. This bacterium is well known to physicians, but worldwide, we're seeing this organism bounce back this year after not having played much of a role the last few winters. As some of you know, Warren County reported a cluster of pediatric pneumonia cases last month. By state laws, certain diseases are serious enough health threats that individual cases are reportable, meaning providers must report them to the Ohio Department of Health. Other illnesses, such as pneumonia, are not reportable unless they cause an outbreak, which just means an unusual number of cases of the same illness at the same time in the same area. It's important to note for context that throughout a normal respiratory season, county-level outbreaks of respiratory illnesses like we saw in Warren County are not unusual. As we have been in communication with health officials there, the outbreak appears to have been caused by a variety of common organisms, including Mycoplasma. We also are encouraged to hear that the number of new cases reported in Warren County has slowed recently. There is a pneumonia vaccine available, but it's for another bacterium, Streptococcus pneumoniae. There is no vaccine for Mycoplasma, and there are many causes of pneumonia. It also has been a year of elevated cases of pertussis in Ohio. The disease, also known as whooping cough, can cause serious illness, especially in babies and young children. Historically, many diseases have cyclical patterns. And according to CDC data, pertussis tends to peak every 3 to 5 years. What we're seeing in Ohio is not outside the realm of these periodic increases. But pertussis is preventable and is among those vaccines on the CDC's list of childhood immunizations. and is also required by Ohio law in order to attend school. It's delivered in combination with the vaccine for diphtheria and tetanus and is called the DTaP vaccine. As was the case with other childhood immunizations, the percent of Ohio children entering kindergarten who are up to date on their DTaP vaccine dropped in the pandemic school years of 2020 to 2021 and 2021 to 2022. We were heartened to see those numbers rebound last school year, that is the 2022-2023 year, and we certainly hope that trend continues this year. Taken all together, the prevalence of these respiratory illnesses in Ohio should say emphatically to us that we need to take advantage of all the preventative tools that we have available to us. Those tools, of course, begin with vaccines. The flu vaccine for most Ohioans, the COVID vaccine, especially for those age 65 and older and with compromised immune systems, as well as some underlying health risk factors, and the RSV shot for expectant mothers and infants. It's also important to dress warmly and appropriately as you go out in the now cold weather to maintain good nutrition and eat foods rich in vitamin C and vitamin D, and be mindful of air quality, especially when you're indoors. And now I want to welcome our guest today, Dr. Joe Gastaldo, an infectious disease specialist and vice president for clinical affairs for Ohio Health Dublin Methodist and Ohio Health Grady Memorial Hospital. Dr. Gastaldo, I just mentioned some prevention tips, but as you're looking at respiratory illnesses in your practice and also around the country and the world, what are your best recommendations for patients in terms of prevention?
Thank you for the warm welcome, Dr. Vanderhoff. And a lot of them you really hit on. I think what's really different today is the fact that we're talking about these respiratory viruses. And with the exception of the virus that causes COVID-19, the virus that causes influenza, RSV, and other respiratory viruses are not new. We've known about them for a long time. And even with mycoplasma, the bacteria you mentioned, that's not new either. What's different this year, I think, coming out of COVID is everybody is very much sensitive to those. And I think it's good that people want to get a diagnosis. But most importantly, what's new now is we have testing capacity available where you could go to your hospital and if it's clinically appropriate, you'll get a test done in real time and it'll tell you what virus you have infection with or mycoplasma, or for that matter, other bacteria. So that's a good thing. What I usually tell people is obviously take care of yourself. If you have a medical condition like diabetes, monitor your blood sugars, take care of yourself, really be as in best medical condition as you can. Nutrition is important, exercise is important, but most importantly, understand the tools that are available. For the three viruses you just mentioned, respiratory syncytial virus or RSV, we have a vaccine available that may be appropriate for those 60 and above. For pregnant women, as you mentioned, because RSV is a major cause of disease in neonates. We have an influenza vaccine that's FDA approved and CDC recommended for everybody 6 months and older, and obviously a new COVID vaccine. I think it's really important for us to understand that, and really it's very important that people at highest risk for severe disease really get connected with a healthcare provider about their risk in receiving those vaccines.
Dr. Gastaldo, you mentioned mycoplasma, and we've certainly been hearing a lot more about that this year. Can you tell us more about that organism and what patients might expect and how doctors approach the care of patients who are diagnosed with mycoplasma pneumonia?
Yeah, so mycoplasma pneumonia is a bacteria. In the medical world, we call it walking pneumonia. And to be frank, there are many people who have it and don't even know about it. And there's a big part of people who have this bacterial infection who really get through it without any antibiotics whatsoever. So most commonly, people can have mild respiratory symptoms and it goes away on its own. Sometimes people do get hospitalized and become quite ill with it, whether they have at-risk conditions or for that matter, no risks. But what's different about it is we're all sensitive to getting diagnosed and we have testing available. In the past, when I thought about a patient who had Mycoplasma pneumoniae, we had to do a blood test and it would take days to get the blood test back. And by that time, the patient was usually better. Now we have PCR testing, like we have for COVID-19. We have PCR testing available for Mycoplasma pneumonia, and most healthcare systems have that test available in-house. So I think that's a reason why, partly, that we're talking about it more so in this conversation.
Thank you very much. We also, you mentioned RSV. I talked about RSV. I focused a good bit of attention on the role the vaccine can play for infants and expectant moms. But I think you rightly mentioned it can also be helpful for older Ohioans. Can you talk a little bit more about that and share some of the conversations you're having with older patients about that vaccine?
That's a great question, Dr. Vanderhoff. So what we have available is an RSV vaccine for anybody 60 and older. RSV in the elderly can be a major cause of hospitalizations and respiratory failure, severe disease, just like influenza and COVID-19. In that particular case for an RSV vaccine, I think it's a no-brainer that people should get it the older they get. And if people have underlying lung conditions, they're immunocompromised, someone may have COPD or asthma, someone may be diabetic. For those people who are 60 and above, I think it's a no-brainer that they receive the vaccine. For those who, what I call in the 60 range and are healthy otherwise, I think it's less urgent that they receive it. But I think the older someone gets, and if they have underlying health conditions, to me, it's really a no-brainer that they should receive the RSV vaccine.
Well, thank you very much, Dr. Gastaldo. In conclusion, I want to reinforce what Dr. Gastaldo and I have been recommending to help prevent the spread of these winter respiratory viruses. Even though we're thankfully not in a pandemic state any longer, I hope we don't let our guard down. Some of what we can do to stay healthy includes very basic steps. Wash your hands frequently, cover your mouth when you cough. I'd also, though, ask you to be mindful of protecting others. This is the time of year for large indoor gatherings of family and friends. But if you're not feeling well, if you have a cough or congestion or other symptoms, even without any sort of official test or diagnosis of some kind, please consider staying home. There are those who are more vulnerable to respiratory illnesses, and by making the choice to stay home if you're sick, you're protecting everybody. And of course, really the foundation of prevention in the modern era is getting vaccinated. So as we've shared, if you have the opportunity yet to be vaccinated, please get out and get a shot. I wish you all a very happy and healthy holiday season. And with that, Ken, I think that we are ready to take questions.
Okay, thank you, Dr. Vanderhoff. A reminder to please limit yourself to one question. And our first question today is from Stephen Langell, IdeaStream Public Media.
Yes. Thank you so much for your time. I was just trying to better understand what steps the department's been taking to ensure that communities, especially low-income, disadvantaged, underrepresented communities, have the access to affordable access to vaccines that are both easily accessible and affordable, and that they also know that such vaccines are out there.
Yeah, thank you. We're doing a great deal, and I'll share a little bit at a high level, and of course, we can get you further information following this press opportunity. It begins with our partnership with the federal government around the Bridge program for COVID-19, which is a program that is designed to ensure that those who might not fall into the wide net of insurance coverage, including in Ohio, Medicaid, which covers the large majority of our children, have the opportunity to get access to these vaccines without the cost being a barrier. But it extends then to the other vaccines as well through programs like Vaccines for Children, which also help us with the financial challenge of providing that bridge. In addition, we have been working very closely with local health departments, with providers throughout the state to get the word out and message out. We also have a pretty highly developed social media campaign designed to help get that message out, and there's more. So we'll provide you with more detail following this, but rest assured, this has been a major focus of the Department of Health.
Thank you.
Our next question is from Chris Medrano, ABC News.
Hi, good morning. I just wanted to confirm, are we seeing the number of pediatric cases of pneumonia starting to go down, or are they still rising and the numbers of new cases are just starting to slow?
Well, I'll answer that question at a high level. And I'm not sure if you're referencing specifically the outbreak that was reported in Warren County. Is that your focus, or are you talking just generally?
Yeah, if you could speak on that, and then maybe just in general in terms of the mycoplasma and the strep pneumo cases.
Sure. Okay. So Warren County is counting cases of pneumonia that they have had since August, which would include the entire respiratory season so far. And we looked at the data for people in Warren County in that large area in terms of reporting to the emergency room for unspecified pneumonia this year, and compared it with the same time frame in 2019 and 2022. And there is no difference in the number of people in that area presenting to the emergency room with pneumonia than what we saw in 2019 and 2022. Now, we couldn't compare this year to 2020 or 2021 due to COVID-19 and the obvious impact that had on respiratory illness cases in the state. Additionally, we looked at the hospital capacity in that area, and it too is comparable to 2019 and 2022. So this information leads us to believe that this year is similar to past years in terms of respiratory season and the amount of pneumonia that we're seeing in Warren County, which it appears to be fairly in line with the trends of previous years. And as I mentioned, it's not at all uncommon in any respiratory season for a particular county to reach the outbreak threshold, and yet the entire state, does not similarly reach that threshold.
Thank you.
Our final question today comes from Jim Provence, the Toledo Blade.
Hi, Dr. Vanderhoff. Thanks again for doing this.
Sure.
You talked about these multiple viruses. Is it possible to get more than one of these at one time? Does one make you more vulnerable to the other? And if you do get multiple viruses at the same time, does the treatment change?
Yeah, it's a very good question. I, of course, have an infectious disease expert on here, and I will lean heavily on him. But at a very high level, the unfortunate thing is that people can have multiple respiratory illnesses within a very short time frame. And that's really part of the prevention concern for us. It's why we're so emphasizing taking those steps that help protect us, especially vaccination, because there are so many threats out there. Dr. Gastaldo, could you go into a little more depth? You're an infectious disease physician, and this is really your area of expertise.
Yeah, thank you, Dr. Vanderhoff. That is a great question. And the simple answer is yes, you can get infection with more than one bacteria or a virus at the same time. In fact, we've seen that during our COVID surges, the real surges we've had before in the past. We've had people co-infected with COVID and other respiratory pathogens. Typically what happens is this: when somebody is hospitalized for pneumonia, what is happening is before we get our test results back, it's very important to start them empirically on appropriate antiviral agents and antibiotics. We do our testing, and then as we get test results back, we tailor our medications appropriately, meaning that if our testing does not reveal a bacterial infection, we'll stop the antibiotics after we have that information. But just to reemphasize Dr. Vanderhoff's point, the best tool you have to really protect anybody from severe disease resulting in hospitalization and death is with a vaccine.
All right, we want to thank everyone again for joining us today. And Dr. Vanderhoff, do you have any closing remarks?
Well, I want to thank everyone again for joining us. I want to again emphasize the importance and the opportunity that folks have to get out and get a vaccine if they have not yet done so this year. There are real benefits, and I want to wish everyone a very joy-filled, happy, and healthy holiday season.
And this will conclude today's press conference. Thank